Every pet owner wishes they could understand the quiet signals their dog gives when something feels wrong. In this video, the focus turns to the subtle warnings many people miss, and right in the middle of it all is the key phrase, 16 hidden signs. Your dog is silently begging for help. These silent clues can reveal discomfort, stress, or underlying health issues long before the situation becomes serious. Paying attention to these signs can completely change the way a dog's well-being is protected. Before diving in, don't forget to like, comment, and subscribe to the channel for valuable guidance you can trust. Number 16. Sudden withdrawal from family. A dog that usually stays close suddenly choosing isolation can be one of the earliest signals that something is wrong. The shift may appear gradual, but it often reflects pain, emotional stress, or an internal discomfort that makes social interaction exhausting. When a once energetic companion begins spending extended time alone under beds, in corners, or away from the usual resting spots, that quiet change deserves attention. Dogs rely heavily on companionship and proximity, so withdrawing from familiar people and activities is never random. It can be connected to illnesses, hidden injuries, digestive discomfort, or even anxiety. Taking note of when the behavior started and how frequently it occurs becomes essential because isolation is one of the clearest silent requests for help a dog can give. Number 15. Unusual sleeping patterns. A noticeable increase or decrease in sleep can indicate that a dog is struggling internally. Dogs are known to sleep a lot, but sudden excessive fatigue can be a sign of infections, hormonal problems, or chronic pain that drains their energy. On the other hand, a dog that cannot settle, keeps pacing at night, or frequently changes resting positions might be trying to avoid discomfort from joint pain, breathing issues, or abdominal pressure. Sleep is one of the most sensitive behaviors in dogs, and any drastic change in the way they rest or the number of hours they sleep often reflects deeper issues. Ignoring this shift can delay addressing a health condition that requires timely care. Number 14. Constant paw licking. A dog that repeatedly licks its paws may not just be grooming. Continuous licking is often connected to allergies, skin infections, insect bites, or irritation caused by chemicals on the ground. It can also be linked to joint pain or anxiety, where licking becomes a comforting behavior rather than a cleaning habit. When the licking becomes frequent enough to cause redness, moisture, odor, or hair thinning, it signals that the body is trying to cope with discomfort that must be addressed. Many owners miss this sign because it looks harmless, but constant paw licking is one of the most common silent pleas for help. Number 13. Sudden aggression or irritability. A gentle dog showing unexpected aggression or irritability might be reacting to pain. Dogs rarely lash out without reason. When touched in sensitive areas, picked up, or approached while resting, they may react defensively because something hurts. This shift can stem from joint issues, ear infections, dental problems, or internal discomfort that makes normal interactions feel threatening. Behavioral changes rooted in physical pain are often misunderstood as disobedience, when in reality they are desperate attempts to communicate distress. Recognizing this change early prevents both emotional stress and worsening health problems. Number 12. Heavy panting without activity. Panting after exercise is normal. Panting at rest is not. Heavy breathing when the room is cool and the dog is calm can indicate heart issues, respiratory problems, fever, heat stroke risk, or anxiety. Dogs pant heavily when their bodies struggle to regulate temperature or receive enough oxygen. If the panting starts randomly, continues longer than usual, or is accompanied by drooling, restlessness, or trembling, the dog could be signaling discomfort that cannot be ignored. This is one of the more urgent hidden signs because, Breathing is closely tied to a dog's overall stability. Number 11. Sudden change in eating behavior. A dog silently asking for help might refuse food, eat significantly less, or in some cases, consume more than usual due to illness or anxiety. Loss of appetite is often connected to dental pain, stomach issues, infections, or emotional stress. Meanwhile, overeating or rapid food consumption may indicate nutrient deficiencies, metabolic disorders, or insecurity around meals. Any sharp change in eating behavior is a key indicator of internal imbalance. Dogs are creatures of habit, and mealtime routines rarely shift without a meaningful cause. Number 10. Staring at walls or getting stuck. A dog standing still, staring at walls, or pausing in corners without moving may be displaying neurologic symptoms, cognitive decline, or anxiety-related confusion. These behaviors can resemble daydreaming, but they often signal trouble with brain function or sensory processing. When a dog seems lost in familiar environments or appears unable to navigate around furniture, it is silently communicating that something feels off inside its body. Many owners assume it is simply old age, yet this sign can also appear in younger dogs with neurological inflammation, toxin exposure, or extreme stress. Number 9. Tail tucked for long periods. A tucked tail is not always a reaction to fear. When it stays tucked consistently, it may be a sign of back pain, abdominal discomfort, or emotional distress. The tail acts as a balancing tool and an emotional indicator. So when a dog protects it tightly between the legs, something is triggering discomfort or insecurity. Persistent tail tucking can also suggest anal gland issues, joint problems, or pressure in the hips. This subtle posture speaks loudly when interpreted correctly, because dogs use their tails to express everything from confidence to pain. Number 8. Rapid weight loss or weight gain. Noticeable, unexplained changes in body weight can reveal hidden health problems. Weight loss without diet changes may indicate thyroid issues, diabetes, infections, parasites, or poor nutrient absorption. Meanwhile, sudden weight gain can be linked to hormonal imbalance, emotional stress, fluid retention, or decreased mobility caused by pain. Dogs maintain weight relatively consistently, so abrupt changes signal internal struggles. Monitoring body shape, muscle tone, and overall appearance provides early clues that a dog is asking for help long before serious complications develop. Number 7. Sudden excessive drooling. Drooling is normal for certain breeds, but when a dog begins drooling far more than usual, it becomes a quiet signal that something serious might be developing. Excessive saliva can point to dental infections, mouth injuries, stomach irritation, nausea, or even exposure to toxic substances. Dogs may also drool heavily when they are in severe pain or extremely anxious. When the drooling soaks the floor, continues during rest, or becomes paired with pawing at the mouth or refusing food, the body is sending a clear warning that something internal is out of balance. This sign often appears before other symptoms become obvious, making it one of the most important hidden clues to notice early. Number 6. Difficulty standing up or climbing. A dog that suddenly struggles to rise after resting or hesitates to climb stairs may be experiencing joint pain, arthritis, muscle weakness, or problems with the spine or hips. Many dogs try to hide their discomfort, so these mobility changes often appear subtle at first. They may take longer to get up, shift their weight awkwardly, or pause before jumping onto furniture they once climbed with ease. This hesitation is not laziness. It is the body signaling that certain movements cause pain or pressure. Mobility issues should never be dismissed because they can worsen quickly if ignored. Early attention can prevent long-term suffering and maintain a dog's quality of life. Number 5. Persistent bad breath. Bad breath can be more than just an unpleasant smell. When it becomes strong, sour, or unusually foul, it often reflects hidden dental disease, gum infections, or even organ-related issues such as kidney or liver problems. Dogs mask discomfort extremely well, so the mouth becomes one of the clearest places where internal illness reveals itself. A dog may continue eating normally while silently battling pain, inflammation, or bacterial growth. When breath changes out of nowhere, or when drooling and difficulty chewing appear, it becomes a reliable sign that the body needs immediate attention. Ignoring this warning can allow infections to spread and cause serious long-term complications. Number 4. Restlessness or pacing for no reason. A dog that cannot settle, keeps pacing in circles, frequently changes resting spots, or appears uncomfortable even in calm environments might be experiencing internal distress. Restlessness can stem from anxiety, pain, nausea, or breathing difficulties. It may also be linked to heart problems or neurological conditions. This behavior is especially concerning when it happens during nighttime or when the home environment is quiet and stable. Dogs naturally seek comfort and routine, so when the ability to rest disappears, it becomes one of the clearest silent pleas for help. Number 3. Sudden vocalization changes. Dogs communicate through sound, and any sudden increase or decrease in barking, whining, whimpering, or growling often indicates discomfort. When a quiet dog becomes unusually vocal, it may be expressing pain, fear, or confusion. When a normally vocal dog becomes silent, it may be suppressing signs of injury or weakness. Dogs rarely change their vocal habits without a meaningful reason. These shifts can be connected to ear infections, neurological issues, stress, or internal discomfort that becomes too much to handle quietly. Paying attention to voice changes helps reveal hidden suffering that might otherwise go unnoticed. Number 2. Limping or favoring one side. Limping is one of the most obvious signs that something is wrong, but dogs often try to hide pain until it becomes severe. A limp that appears suddenly, comes and goes, or worsens after activity shows that weight-bearing is painful. This can be caused by sprains, torn ligaments, fractures, paw injuries, or infection. Favoring one side of the body or walking unevenly often points to deeper joint or muscle problems. Dogs may also become quieter, more cautious, or slower when moving, which further signals that they are silently asking for help. Number 1. Changes in eye appearance. The eyes often reveal internal problems long before other symptoms appear. Cloudiness, redness, constant blinking, excessive tearing, or a sudden glaze over the eyes may indicate infections, injuries, allergies, or even neurological conditions. Dogs with eye discomfort may squint, avoid bright light, or rub their faces against furniture or the floor. In more serious cases, eye changes can be linked to high blood pressure, immune-related issues, or unseen trauma. Because eyesight is so vital to a dog's sense of security, any shift in the eye's appearance becomes one of the most significant hidden signs that a dog is silently asking for help. Every dog communicates through small, quiet changes long before a situation becomes dangerous, and recognizing these signs early can transform the care they receive. Paying attention to patterns, behavior shifts, or sudden discomfort helps strengthen the bond between you and the companion that relies on you every day. Before you leave, don't forget to like, comment, and subscribe to the channel. And thank you for taking the time to look out for your dog in the most meaningful way.